So it's really an honor to be back up in San Francisco, though it's harder to park this year. And we're happy to be here, and also then to be at the carnival, which is a lot of fun. Did all you guys make it to the carnival in a few weeks? Yeah. Okay. So I'm the medical director of the Bay Area Children's Association, and we were the recipients of the proceeds from the carnival last year, and it was really, really helpful. And again, we're honored to be invited back this year. Very quickly, just a little bit about myself. I am a Bay Area native and born in San Jose. Was at Berkeley for undergraduate, University of Michigan for graduate school, Wayne State University for medical school, spent some years in Arizona doing adult psychiatry, which to work with kids, you have to train with adults first because we've got to help the parents. And then finished my education at Stanford doing a combined fellowship with kids and some research, and my research area is bullying and victimization. And during the research time, developed a self-report questionnaire for children to talk about so we can assess their bullying and victimization. I've written a book on for teens living with peer pressure and bullying, and I'm a spokesperson for the American Academy of Child and Adolescent Psychiatry on bullying. This year, this is new from last year, we have a questionnaire we're developing for teachers called the Teacher Interactions in Primary School. Because the problem with bullying interventions right now is there's too much focus on go give a talk to the kids, but research actually shows that if you don't start from the top down, that those talks to the kids can actually make bullying worse at schools. But there's a lot of culture change that has to happen in the school districts in order to get them to give time for something like bullying and victimization. So that's where we're headed with the research right now. And then with all that piece aside, I was just, during my training, you get frustrated with certain bureaucracies and trying to change systems that don't work. And so even at Stanford, right, Stanford University, that's a good university, trying to have the outpatient clinic run properly or get funding to do the proper research or even to get proper integrated care for full families, it just wasn't happening. And even though we preached these scientific principles about proper treatment, we couldn't make it happen there. So I started my own nonprofit to try to address some of these issues. So we're 60 years old, not quite the 90 years of United Way, but we're still alive. And if any of you have ever had mental health care, you know that for medical care, we're pretty good at integrating those services in one place. But for mental health care, if you take someone with a child with autism, sometimes the families are going to 10 different places to get the services they need for their kid. And there's lots of reasons why there's still those biases in the system. So our clinic puts everything in one place. We'll go to the schools, we'll go to the home, and we try to make things simple for families. Next slide. And then, so we want to just get a clinic that can help kids for all sorts of mental health issues, for whatever the reasons, free from any type of discrimination. So last year they asked us to talk a little bit about our Wells Fargo relationship, and last year we had, on the next slide, this view, where I could look out the window and see a Wells Fargo across the street. Thanks to the campaign last year, we don't have that view anymore, and we've actually quadrupled our space. So we moved from that 1,600 square foot office, we just got the keys and I'm taking over an 8,000 square foot space. That actually, if we didn't have the check from the Wells Fargo Carnival, our security deposit check would have bounced. So really, the timing was perfect last year. And we'll talk a little bit, our goal for the end of next year, we're the full size in San Jose that we're gonna be, but we're looking to open 3 branches. So BACA Santa Cruz, we have 10 to 15% of our clients make the treacherous drive over Highway 17 to come see us because there's no services in Santa Cruz. We're going to go for LA. We're still going to call it Bay Area Children's Association, though, to keep the Northern California vibe going. But we hope to have them open by the end of next year. And then we're training the medical director for a San Francisco branch that we hope to have open by the end of next year. San Francisco actually provides good care for kids with lower socioeconomic status, but anyone who has insurance or just needs to get integrated care in a clinic, it's still lacking in San Francisco as well. So we're going to start opening other clinics and other branches. And We've been able to help a lot more patients and families, so we did 2,500 mental health visits in the last year. We've added 200 families that are currently under treatment at our clinic, and we've grown from 11 employees to 21 employees now. And we have lots of new programs that we're putting in place thanks to our space and help from Wells Fargo. Has anyone heard of Minecraft here? So big for bullying and victimization is we've got to teach proper social skills to both bullies and victims. And so we developed a Minecraft social skills group where they come play on our Minecraft server and learn how to interact politely. And we're studying it. There's no research on this. We're going to present nationally next month at our meeting in Florida. About some of the data that we're collecting for that group. We've added yoga, mindfulness, parent support groups, social anxiety groups. Prevention's the best medicine, so we're starting a group for pregnant women and families to come in and learn about the stresses of parenting. And we've started these 2 intensive outpatient programs. We'll talk a little bit more about this. So in April, we started an intensive outpatient program. Does anyone know what IOP stands for? What that means in the mental health community, right now, if you have a child who's suicidal because they've been bullied, they get put on a hold and locked in a psychiatric hospital, which is essentially just 24 hours a day monitoring. There's no real treatment that happens in those facilities. So as an alternative to that, we've got an intensive outpatient program where the kids spend 10 hours a week in our clinic, and we get all scientific therapy principles working with the schools and families. We force the parents to come in, fix things in the house, and it's a great alternative to hospitalization for kids who need care. So we've started our teenage one in April, and this month we're going to open one for younger aged kids as well. We're also developing our own electronic medical record system to link all the clinics together. Right now, electronic medical record systems are designed for billing and to collect money for the hospital systems, but we need one that's designed to improve outcomes and treatment for the kids. So we're working on that as well. We still have some challenges. We still struggle getting some loans and lines of credit because of our nonprofit status. It's easier if you're a for-profit small business association. We've done really well on the staff piece, so that's not as much of a struggle right now. There's a shortage of mental health providers and especially child and adolescent psychiatrists. But we have 6 on board and 2 more signed, and people believe in the vision of what we're doing and not just writing prescriptions for medications, but integrating care in one place. So we're doing well with the staff piece. We still have challenges to get into schools and training other clinics and providers to provide the right care. And there's still unprecedented demand for services that we're working on. So here's a few reviews we threw in from the IOP, some of the kids who started in the IOP. And these ones might have a timer on them, but depending on how fast you guys read. So I wanted to talk a little bit about just our society and some of the problems we face in changing this culture around mental health treatment and helping kids who are bullies and victims. So suicide data and data on death rates just came out for 2011. The bad news is that suicide is now the #2 cause of death for kids age 15 to 24. It just passed homicide, so now more kids and young adults die from suicide than homicide. Does anyone know what the #1 cause of death is? Car accidents. So the #2 cause of death is a highly preventable illness that can be treated and stopped, and it's disheartening that the death rate has gone up to be #2. For comparison, deaths from cancer were 3.7 for 100,000, so 3 times more deaths from suicide than from cancer. And then if we look at the next slide, so let's look at the differences in funding that you can get for mental health care versus cancer. If we look at the St. Jude's Children's Research Hospital, which is a great facility and provides innovative cancer treatment, Just in 2011, they received $475 million from contributions, grants, and gifts to help the kids with cancer. By comparison, the National Alliance for the Mentally Ill, or NAMI, which is in charge of services for both adults and kids, received just $8 million in contributions, grants, and gifts. But then this is the point that I talked about in all my speeches and talked about last year, that a death of a teen from cancer or a kid from cancer versus a kid that's killed themselves, the pain is the same to the parents. And for so many societal and cultural reasons that go back years and years, this is the battle we face in bringing mental health issues, bullying and victimization and everything to get the same sort of non-stigma, non-discrimination that versus other medical illnesses. So 1 in 4 children and 1 in 3 adults has a diagnosable mental illness, and as high as 1 in 2 kids suffer from bullying and victimization. It's fair to say that probably everyone in this room loves someone who's dealing with some type of mental illness. So we are very grateful to be here and ask you to please help us on our mission to revolutionize care and change the culture around mental health treatment to bring it up to the same level as other medical illnesses. Please feel free to contact me anytime about anything. My OCD nature that got me through schools, I keep my inbox clean. I'm happy to lend guidance for any issue. And we're excited about the carnival and to have a clinic open here by the end of next year. Thank you very much.